Hello friends, welcome to my channel Nourish Nectar. So today we are diving into the critical and dynamic world of emergency medicine. In today's video, we will be exploring the emergency medicine, that is the initial assessment and management of the patient. So if you are new here, make sure to hit that subscribe button and ring the bell icon so you never miss an update. And if you find this video helpful, give it a thumbs up and share it with others who might benefit from this information. So let's get into it and learn how we can make a difference in those critical first moment of an emergency. Here the first injection is injection of Lasix. So here, which is typically used in situation required rapid diuresis such as acute pulmonary edema, severe hypertension or other condition associated with the fluid overload. So this is a potent loop diuretic that works by preventing the kidney from reabsorbing the sodium and chloride. So which is leading to the increased urine production. So here the main key point is indication. So that is acute pulmonary edema, acute congestive heart failure, severe hypertension, renal failure and hyperkalemia. So here the dosage and administration is the dosage of the furosemide can be vary significantly, that is based on the condition being treated and the patient response. For acute pulmonary edema, a common initial dose might be 40 mg intravenously, so which can be increased as necessary. Here, the patients receiving the furosemide should be monitored for electrolyte imbalances, that is, example hypokalemia and hyponatremia, and also renal function and the fluid status. So here, blood pressure and the volume status should be also closely monitored. And the contraindication and precautions are there, that is, furosemide should be used with the cautions in patient with severe electrolyte depletion and anuria and those with hypersensitivity to sulfonamide. So it can also cause ototoxicity, especially with the rapid administration, and side effect also can be seen, that is common side effect is include electrolyte disturbances and especially low potassium level, that is dehydration, hypotension and renal impairment. So more severe but rare side effect include ototoxicity and allergic reaction. Next comes with atropine injection. Atropine is an anticholinergic medication that is commonly used in emergency setting for various indications. It works by the blocking the action of acetylcholine on muscarinic receptor, which is leading to increased heart rate and decreased secretion. So here the key point is indication, that is bradycardia. Atropine is used to treat symptomatic bradycardia, and in organophosphate poisoning, atropine is critical antidote for organophosphate poisoning, which includes certain pesticide and nerve agent. And in pre-anesthesia, it is used to reduce salivation and bronchial secretion during the surgery. And in ophthalmology, to dilate pupil during the eye examination. So here the dosage is bradycardia, the usual dose is 0.5 mg IV and it is repeated every 3 to 5 minutes as needed up to the total dose of 3 mg. And in organophosphate poisoning, initial dose can be 1 to 2 mg IV. That is repeated every 5 to 15 minutes until secretions are adequately controlled. So in pre-anesthesia, dosage varies but typically 0.4 to 0.6 mg IM or IV. So here the heart rate and the rhythm should be monitored. Here continuous ECG monitoring is very essential, that is when administering atropine for the bradycardia. And the contraindication, the precaution, that is in case of glaucoma, that atropine can increase the intraocular pressure and is contraindicated in the patient with angle closure glaucoma and also in tachycardia, obstructive uropathy and GI disorder. Here side effect also can be seen, that is common, that is dry mouth, blurred vision, photophobia, tachycardia, urinary retention and constipation, and severe, that is acute angle closure glaucoma, severe tachycardia and arrhythmias. So the next comes with the digoxin injection. Digoxin is a cardiac glycoside which is used primarily in the treatment of various heart conditions, that is particularly atrial fibrillation, atrial flutter and heart failure. It works by the inhibiting the sodium potassium ATPase pump, which is leading to increased intracellular calcium concentration and enhanced cardiac contractility. The dosage is to administer a loading dose, that is example 0.25 to 0.5 mg IV initially, followed by additional doses based on the patient response and clinical condition, typically totally 0.75 to 1.5 mg over 24 hours. Maintenance doses are individualized, often ranging from 0.125 to 0.25 mg daily, adjusted based on the serum level and clinical response. Digoxin is typically administered slowly over at the least 5 minutes to reduce the risk of toxicity. And potassium, magnesium, calcium levels should be monitored as imbalance can increase the risk of digoxin toxicity. Digoxin is primarily excreted by the kidney, so renal function should be monitored and dose adjusted accordingly. And here the contraindication and the precaution, that is ventricular fibrillation, acute myocardial infarction. Next comes with the injection of potassium chloride, which is used primarily to treat or prevent potassium deficiency. So here the purpose is administered to correct or prevent the hypokalemia, which can occur due to various conditions like prolonged vomiting, diarrhea, use of certain medication like diuretic, or in certain diseases. Administration, that is intravenously, and here the side effects are potential side effects which include pain at the injection site, nausea, vomiting, abdominal discomfort, and given too quickly, serious heart issues. So here the patient receiving KCL injection are closely monitored, including regular blood tests to measure the potassium level and ECG to monitor the heart function. And next comes with calcium gluconate injection, which is used for several medical conditions, that is primarily to treat or prevent calcium deficiencies. So here the main purpose is to treat hypokalemia, as an antidote for magnesium sulfate toxicity, and to treat hyperkalemia, and also has an agent in the treatment of severe hyperkalemia or hypermagnesemia. So here the administration is given intravenously. The injection should be administered slowly to avoid adverse effects such as arrhythmias. And here the dosage and rate of administration depend on patient specific condition and the severity of the calcium deficiency or the other condition being treated. So next comes with the sodium bicarbonate emergency injection. So this is typically used in medical emergencies to treat conditions such as severe metabolic acidosis, certain drug overdose, and hyperkalemia. So here are some key points, that is metabolic acidosis. Sodium bicarbonate helps to neutralize excess acid in the blood. And drug overdoses, it can be used in cases of tricyclic antidepressant overdose and other toxicity where the alkalization of the blood is needed. And at last, hyperkalemia, that is by raising the blood pH, it can help shift potassium into cell, thereby lowering blood potassium level. So here the administration of sodium bicarbonate should be done under strict medical supervision, as improper use can lead to complications like alkalosis, hypernatremia, and hyperkalemia. So before we wrap up, let's quickly recap what we have covered today about emergency medicine. So that is injection Lasix, injection atropine, injection digoxin, injection potassium chloride, injection calcium gluconate, and injection sodium bicarbonate. So if you found this video helpful, please give it a thumbs up and consider subscribing to our channel for more content. Don't forget to hit the bell icon so you get notified whenever we post a new video. So, if you are interested in learning more, check out the links in the description for some additional resource on emergency medicine. Next week, we'll be dividing the topic, so stay tuned for that. Thank you so much for watching, and as always, stay curious and keep learning.